Okay guys, Timmy coming at you here, and today what I'm going to do is I'm going to go over the pathophysiology of asthma. I'm going to go over the pathophysiology, and then I'm going to go over some of the signs and symptoms, how you diagnose it, and then finally how you treat it. Alright, so a couple of things you got to be aware of. First of all, asthma is one time that the body does stuff that doesn't make sense, right? Asthma, by definition, is an overreaction of the immune system. So it is an allergy in your respiratory tract. And this allergy then produces the signs and symptoms of asthma. But this is important. Asthma is caused by this overreaction of the immune system, and the immune system, I'd write this down, tattoo it someplace. The immune system's job is to do one thing, and that is to produce inflammation. Inflammation protects you, right? So the immune system produces this inflammation to protect you. Unfortunately, in asthma, it overreacts to something that it shouldn't overreact to. So it produces this inflammatory response that is simply just too much. So let's look here and see if we can make sense of this. Alright. Now, in people with asthma, it is an allergy, an exaggerated immune response that is primarily found in the bronchioles, and the bronchioles of the lungs are the smaller airways, and they are made of muscle, and they're made of smooth muscle. And we learned that the two things muscle can do is contract and relax. So a couple of things just real quick. As a quick review of some of the anatomy of the respiratory tract. Number one, you got to know it is very vascular. Lots of blood vessels, lots of arteries, right? Got to get that surface area to exchange gas, so it's real vascular. Number two, it has goblet cells, and those goblet cells that they secrete mucus. That mucus is protective. Secrete, yep. Right, so it catches the bad stuff, and then you have cilia that move that bad stuff to the back of your throat where you swallow it or you spit it out. Alright, so let's say, for example, that you're allergic to cats, and a cat walks by you and you say, "Here, kitty, kitty," and you pet the cat, and then you suck in this black stuff because it's bad. This is a cat hair ball. Alright, I labeled it for you too. Ain't that nice? So you just sucked in a cat hair ball, and you are allergic to cats. So what's an allergy? It's an exaggerated immune response. What's the function of the immune system? To produce inflammation. Where does asthma primarily affect? It primarily affects the lower airways, and specifically the bronchioles. Now, the bronchial wall, very vascular, and it's also made of muscle. Now, normally, air, when it gets into the lower airways, it likes to flow in a laminar fashion, a layered fashion. Now, if you have a flute and you put holes in the flute, yeah, there's a little mouthpiece, and then there's the end here. I don't know how a flute looks. And then you blow into it. The reason it makes noise is because the air will flow turbulently. and turbulent airflow in the lungs produces a sound. So remember that in the lower airways, normally you want that air to flow in a laminar fashion. But with asthma, it begins to flow turbulently, and I'll explain that in a minute. So watch. You sucked in the cat hair ball, you're going to get an exaggerated immune response. What did I just say to you? I told you that the lining of the respiratory tract is very vascular. And how you get inflammation is you get vasodilation. The arteries and arterioles that line the respiratory tract, they will dilate. And when they dilate, they will become engorged with blood. So that will cause the diameter of the bronchiole to get smaller. Now, what's going to happen to airway resistance? Just like in blood pressure, airway resistance is going to go up. Right? You made the bronchiole smaller. So that's going to increase the resistance to airflow. So what that person has to do is they have to create a greater airway pressure, right? They have to increase the amount of pressure between the lungs and the atmosphere to try to overcome this resistance. And how you create a greater difference in pressure between your lungs and the atmosphere is by creating a greater lung volume. So as a result of the swelling of that vascular lining within the bronchioles, that's going to increase the resistance to airflow, so the person has to breathe harder to try to overcome that resistance. So their breathing becomes labored, right? They will start using the accessory muscles of ventilation, right? They will start contracting their intercostal muscles. They will start using the sternocleidomastoid muscle, so to raise the rib cage to try to overcome this resistance. The other thing that happens is goblet cells start secreting more mucus. So the airways become further clogged with mucus. So that makes the resistance go up even more. Now, you have these cells of the immune system, and these leukocytes, they release chemicals called, leukotrienes. And these leukotrienes then will bind to leukotriene receptors in the smooth muscle that make up the bronchial wall. And those leukotrienes will cause the muscles, the bronchial muscles, to spasm. So you get bronchospasm. So in the end, what you have done is you have made the airways within the bronchiole smaller due to the inflammatory response and the vascular lining dilated. And then due to the cat hair ball, you get increased mucus production, so that makes it even smaller. And then you get the release of these chemicals called leukotrienes, and that will cause the bronchial muscles to spasm. Now, again, we talked about this. Normally, in the lower airway, you want the air to flow in a laminar fashion, right? But what happened? You got those leukotrienes released, and now the bronchial wall, the bronchial muscle within the bronchial wall, it's going to spasm. So the walls, the muscles spasm, and that creates no longer laminar flow, but turbulent airflow. And turbulent airflow produces wheezing. That is why people with asthma wheeze. So, that's the basic pathophysiology of asthma. Again, it's a smaller airway, exaggerated immune response. So the signs and symptoms of asthma, number one, you're going to become short of breath, right? Number two, your breathing will become labored, right? Because you got to overcome that resistance. Number three, they will start to cough. The cough is the result of increased mucus production. Number four is they will begin to wheeze. And number five, they'll have poor activity tolerance. I can spell that. Right, so those are the things that you're looking for. Now, in children, right, if they're laying there watching the Teletubbies and you see their diaphragm contracting massively, and you know that their diaphragm's contracting massively, because when the diaphragm contracts normally, it flattens out and will squish their guts a little bit. But if they're having a hard time breathing just laying there, their diaphragm is contracting massively to try to increase that lung volume, and it will cause their guts to balloon out. And you'll also see the muscles inside between the ribs contracting like crazy, and the reason they're contracting like crazy is trying to raise those ribs to increase the volume of the chest so they can overcome that resistance. If you see that in a kid, you grab them, you take their fatty acid to the emergency room because they are in trouble. So those are the classic signs and symptoms of asthma. So what do you do for people with asthma? Let's look at this. Better write this down. Better not pout. Number one, in the lining that make up the blood vessels, you have beta 1 receptors. Listen up. These beta 1 receptors make up the vascular lining, the blood vessels. You got me? Number two, you can't see that. Number two, you have beta 2 receptors. Beta 2 receptors that make up the smooth muscle of the bronchioles. Very important that you get that. And number three is, there ain't no number three. That's all I got there. All right. So remember, beta 1 that make up the arteries, the arterioles that supply that lining, and beta 2 make up, you have receptors for that in the smooth muscle of the bronchioles. So let's recapitulate here. Blood vessels, receptors, beta 1. Receptors on the smooth muscle, that's beta 2. Got me? What caused this mess to begin with? An exaggerated immune response. So do you want your immune system to over-exaggerate, to just aggressively cause inflammation when you're exposed to cat hair balls? No, you don't. So what you want to do is you want to suppress the immune system, right? I spelled that. Got it. You want to make sure that the immune system doesn't overreact. You want it to chill. So what are the best drugs to suppress the immune system? Right? Steroids. So this is real important. It takes about 3 to 4 weeks of daily steroid therapy to adequately suppress the immune system. so that if you are exposed to a cat hairball, you ain't going to overreact. So steroids are not going to save you if you're having an asthma attack. Those are referred to as the maintenance drugs. So you take that every day. So watch. Let me give you an example. You have a kid. They have asthma. The kid's name is George. And the kid wakes up. And you say, "Good morning, George." And they say, "Hey." And then they're going to look at you and say, "I ain't never breathed better in my life. I'm a breathing mother." Your job is to say, "Take your steroid inhaler." Because how long does it take to adequately suppress the immune system? About 3 to 4 weeks. And you have to continually take that steroid to keep that immune system suppressed. If they stop taking their steroid inhaler because they're breathing good now, it's going to come back. That's why, as a nurse, you have to tell the patients, educate the patients, that if a doctor prescribed an inhaled steroid, regardless of how you are breathing, you take it every single day. The steroid medications are the maintenance medications. Now, if you're having an asthma attack, you're wheezing up a storm, you're having a hard time breathing, right? What do you want to do? You want to open up the airway. So remember, in the blood vessels that make up the vascular lining of the bronchioles, you have beta 1 receptors. And in the smooth muscle that make up the bronchioles, you have beta 2 receptors. And if you get this wrong, if you were in my class, I would personally mark your whole life wrong. What binds to beta receptors? You got it. Epinephrine. So instead of giving epinephrine to treat asthma, what they do is they give you drugs that mimic epinephrine. And because epinephrine is part of the sympathetic nervous system, in your book you probably read the sympathomimetics. These are the drugs that mimic the sympathetic nervous system and mimic epinephrine. So you are looking at the drugs like albuterol. And albuterol, shake it all about, take a hit, right? Suck it in. Albuterol stimulates beta receptors. Where you got beta receptors? Well, all over, but you were talking about the lungs. So when albuterol binds to beta 1 receptors, and where you find those? In the blood vessels that make up the lining of the bronchioles. What does epinephrine do? Epinephrine causes massive arterial vasoconstriction. So it is going to cause the arteries that make up that lining in your bronchioles to constrict. So what's going to happen when they constrict? The lining is going to be open up because the blood vessels aren't as engorged with blood. The other thing that epinephrine is going to do is epinephrine, or albuterol, is going to bind with beta 2 receptors. And when albuterol binds to beta 2 receptors, it will cause the smooth muscle of the bronchioles to relax. And when it relaxes, the airway opens up. So, beta 1, blood vessels. Beta 2, smooth muscle. But you got beta 1 and you got beta receptors all over the place. You got beta 1 receptors in your heart. Boom. And so what are some of the side effects of albuterol? Elevated heart rate, elevated blood pressure, right? They may be anxious, they may be a little jittery, all because they're taking albuterol, which mimics epinephrine. So if you understand how the drug works to be treated, and you know that albuterol mimics epinephrine, if you know what epinephrine does, then you know the side effects of those medications. Now, you give them the steroids, right, to suppress the immune system so you don't have to be using the albuterol. But again, that has to be done routinely, right? You got to maintain that, so you got to take it every day. Now, they've come out with drugs over the past 15, 20 years, right? What caused the bronchioles to constrict? Well, remember these little leukotrienes? So they've come out with drugs, probably heard of Singular. It's an oral medication. And basically what that is a leukotriene inhibitor. So it prevents the leukotrienes from binding to leukotriene receptors in the smooth muscle. And it prevents those bronchioles from spasming. So that's a newer drug. Other drugs that they're coming out with now is they are putting drugs together that are short acting steroids, right? So instead of 3 or 4 weeks, it takes 3 or 4 days to suppress the immune system, and then a long acting 24-hour acting bronchodilator. And dilator, right? So those are drugs like Advair. Right, so you take that once, maybe twice a day, right? The little purple diskette, and it's got a short-acting steroid, which will suppress the immune system, and then it has a long-acting bronchodilator, which will constrict those blood vessels and cause the smooth muscle to relax. So that's becoming more and more prevalent. So that's what I got. Wait, one more thing. Watch. As a nursing consideration, when people are taking steroids, what do steroids do? They suppress the immune system. How do you take it? You take it in an inhaler. So people don't know how to do it. They suck on that inhaler like they're smoking a cigar, and when they shoot the steroid in, it doesn't get into their lungs, it gets into the back of their throat. And what it will do is it will suppress the immune system in the back of the throat. That's why they're told every time you take a steroid inhaler to rinse your mouth out, because if you don't get rid of that steroid inhaler, it will suppress the immune system locally in the back of your throat, and you get thrush. Also, if you can, you educate patients that if you can avoid taking the albuterol inhaler, or if you have kids, the nebulizer close to bedtime, because parents can't understand why little Joey, he took his nebulizer at 8 and he's still up at 3 a.m. watching Cheaters. That's because he's hyped up on a drug that mimics adrenaline. Alright, so that's asthma. I hope it helped. And